Every day, millions of people live with pain that many of us can't imagine. They wake up with aching bones, swollen joints, and face each day with uncertainty. But through it all, they smile, they fight, and they keep going. They are warriors of sickle cell disease. And today, the world poses to honor them. Today is World Sickle Cell Day, a day set aside to raise awareness about one of the most painful and often misunderstood blood disorders. It is a day to remember the struggle, celebrate the strength, and renew our collective call for better care and a cure. According to the National Institute of Health, around 50 million people around the world live with sickle cell disease. Sadly, many still don't fully understand what it means to live with this condition and how it can be prevented. Hello and welcome to this special edition of Health Talk. I am Rebecca Caleb Minor. Today we are going beyond numbers. We are going to hear stories and science of sickle cell. I'm joined with me is Dr. Ahmed Idris, Senior Registrar, Hematology at the Federal Teaching Hospital, Gombe. Thank you, Doctor. Doctor will help us understand the science and solutions behind sickle cell disease. Also, with me is Aisha Adamu Magaji, a true sickle cell warrior. Her life is a powerful story of courage, strength, hope, and she lives with the reality we are about to talk about today. Aisha, you're welcome to GMC TV.
Thank you.
Aisha is also the Deputy Chairperson Gombe State Sickle Cell Club. And together we'll look at the facts, confront the fears, and discuss the future of sickle cell disease and care in Gombe State, Nigeria. You're welcome to GMC Health Talk.
Thank you.
Doctor, we'll begin with you.
Okay.
What exactly is sickle cell disease and how does it affect the body as a whole?
Good morning, our viewers. My name is Dr. Ahmed Idris, Department of Hematology, Senior Registrar, FTH Gombe. Sickle cell disease is a genetic disease that results due to inheritance of abnormal components in the blood that we call hemoglobins. So the inheritance of abnormal hemoglobins in two pairs of the hemoglobin results to a disease we call sickle cell anemia. But the sickle cell anemia is a name under the umbrella of the group of diseases that are referred to as sickle cell diseases. But the most symptomatic forms of the disease is called sickle cell anemia. So this hemoglobin that we are talking about is the hemoglobin S. If an individual inherits two pairs of the abnormal hemoglobin S, is termed sickle cell anemia. The inheritance of one single abnormal hemoglobin S together with the normal hemoglobin A is considered as a carrier state. Carrier state is categorized under the sickle cell disease. But the one we emphasize on is the sickle cell anemia. That's individual who has inherited two abnormal hemoglobins is referred to as sickle cell anemia. So this abnormal hemoglobin is not only the hemoglobin S. There are other forms of hemoglobin that are considered abnormal hemoglobins, like hemoglobin C. Is also considered abnormal. So individual with abnormal S with C is also sickle cell anemia. Individual with abnormal 2SS, HBSS is also sickle cell anemia. Then certain individuals may inherit one abnormal hemoglobin S instead of the hemoglobin A. with either deletion of the other one, what we call thalassemia, or with combination with other forms of abnormal hemoglobin like the C that we talk about, which is hemoglobin SC. So these individuals are also considered under the umbrella of the diseases, sickle cell disease, but particularly the ones that manifest with the classical symptoms, that's the HBSS and HBSC. Commonly in Nigeria, they are the ones that we often talk about as sickle cell anemia, because the other inheritance rarely present with full-blown features of sickle cell anemia.
Okay, so does this disease have signs? What are the signs and symptoms of sickle cell disease?
Thank you, Ma, for the question. The sign and symptoms of sickle cell anemia usually occurs in evolution. The in utero and inside the womb, that was what I mean by in utero. Okay. Inside the womb, while the baby is still growing in the mother's womb.
Okay.
And to the level of birth, usually there are no features up to 6 months after delivery. This is because the baby inherits another form of hemoglobin that is usually knocked down after the age of 6 months, that we call fetal hemoglobin. So this fetal hemoglobin usually has a better oxygen carriage. The main function of the hemoglobin is to carry oxygen. When we breathe in, the air we breathe contains oxygen. It goes to the lungs, it exchanges and is carried in the red blood cell. These blood cells will now distribute this oxygen for the normal body function. But individual that inherits the abnormal hemoglobin has reduced capacity of carrying this oxygen, because the malfunction or the malformation in the red blood cell does not allow it to carry its full potential function. So the individual is not able to distribute oxygen for normal body metabolic processes. All the normal body function, human body system was in a perfect or in a normal functional state will be affected, because it requires the oxygen to make sure that metabolic activities goes on. So what happens usually before the 6 months of life, another form of hemoglobin that
that's while the baby is still in the womb.
After delivery. Okay. For the first 6 months of life,
okay,
there's a particular hemoglobin type that is called fetal hemoglobin that the baby has. So with this fetal hemoglobin, the baby is protected from coming down with the symptoms. Okay. So rarely do we see the symptoms before the age of 6 months. Okay. But after 6 months, this fetal hemoglobin is being knocked down. It's already programmed in the body system that after 6 months, the fetal hemoglobin does not continue to function. And the fetal hemoglobin has better oxygen carrying capacity than even the normal hemoglobin for the normal individual that do not have the disease. The hemoglobin A that we consider as normal, the fetal hemoglobin has a higher oxygen carrying capacity than the normal hemoglobin in the adult. We call it hemoglobin A, adult hemoglobin, because it's the normal in adult. Okay. But in those babies, because of that fetal hemoglobin, they are protected, even though they are sickle cell anemia babies.
Okay.
So usually, it's after the age of 1 year that they begin to have signs. Usually, the common name we call it is hand and foot syndrome. Hand and foot syndrome. They are the commonest signs or symptoms that the baby begins to develop. Usually, why we call it hand and foot, the bones in the hands and the foot, they begin to become swollen and painful because of this inability of the body to deliver oxygen for normal functioning. What we call relative ischemia, inability to have full supply of blood for normal metabolic process. So sometimes, because this the sickle cell we talk about, the red blood cell normal shape is by concave shape, but in the disease state, it assumes the shape of a sickle. sickle that we use in farm work,
Okay, the farm.
instead of the normal biconcave. So these sickle-shaped red cells, in addition, they also block the small blood vessels. So the distal area from the site of blockage does not get the blood at all. So that explains why the intense pain they begin to have. So the baby will be crying, the hands will be swollen, the baby may not be consoled by the mother even with breastfeeding. So these are the earliest manifestation. In addition, if it continues, some part of the bones in the hands and foot can become infected, depending on the outside wall. Like in the tropical countries, the third world countries, where the environment is often dirty, baby is exposed to all sorts of mycobacterial pathogens. So that particular limb can become infected. So they come down with what we call dactylitis. That's the infection that affects the digits, the fingers, either of the hands or of the foot. So these are the earliest manifestations. But in general, from this neonatal to infant age, as the child grows, these painful episodes that we call painful or vaso-occlusive crisis usually are the commonest signs and symptoms. This occurs as a result of precipitants, exposure to certain environmental conditions like extreme of temperature, too much cold or too much hot, you understand, maybe inability to drink as much as possible water to dilute those sickle-shaped red cells. These are some of the precipitants that will make this sickle-shaped red cell to block the blood vessels and result into pains. So these pains commonly are the usual manifesting symptom that is observed in early life.
Doctor, I hear people talk about SS. Has it got to do with sickle cell too?
Yes. Hemoglobin genotype. We have, like I mentioned earlier, we have different types of hemoglobin in the human body system. We have the hemoglobin A, which is the one that is considered as normal adult hemoglobin. We have the hemoglobin S, the one that inheritance of two allele of it by an individual result to sickle cell anemia with genotype SS. We have the hemoglobin C, we have hemoglobin E, we have hemoglobin O, we have D, we have G. So these are all different types of hemoglobin, but some of the other hemoglobins are not common in our setting. The ones we battle more in our setting, like in Nigeria, is hemoglobin SS and hemoglobin SC. These are the commonest form of hemoglobin. Then we have the ones that has interaction with thalassemia as a result of deletion of the gene that carries the primary information for synthesis of those hemoglobins.
Okay. Talking about Nigeria, it has one of the highest burden of sickle cell. Why is it that? And what can be done to reduce it?
Well, the evolution of the sickle cell anemia, according to the scientific studies as well as history that has recently been confirmed by geographic studies, was the evolution of this type of hemoglobin that is called hemoglobin S has a lot to do with prevalence of malaria resulting from mosquito bites. So you realize the countries that are much affected are usually endemic for malaria, usually carry very high burden of malaria. So what is happening, the body system in human beings as well as other animals has a way of evolving new features to adapt with the environmental challenges. So the evolution of this sickle hemoglobin is believed to be as a result of malaria, because the sickle hemoglobin in the carrier state does not allow the severe form of malaria to bring an individual down or to kill the the individual. So it is scientifically believed that the individual with the carrier state, the one that have one normal adult hemoglobin and a sickle hemoglobin, that's the AS that we talk about, they are believed to have some level of protection that is as a result of evolution of adaptive features in human beings. The evolution of that sickle hemoglobin together with the normal adult hemoglobin usually confers some level of protection in individual with AS. But the problem arises when AS begin to marry AS. So, and the baby definitely will inherit the type of genes the mother and the father has. So if the baby now inherit the S component of the AS, that's the disease state, that's the sickle cell anemia. But individual with hemoglobin AS are believed to have protection from severe forms of malaria compared to other individuals with other hemoglobin, like assuming an individual with normal adult hemoglobin and another individual with hemoglobin AS. If both of them will have the same level of parasitemia as from mosquito bite, chances are that the one with AS may not die from the malaria compared to the one with other forms of the hemoglobin. So the problem begins when the individual with AS now begin to marry others with AS.
Okay.
I don't know if I've answered the question
yes,
well.
Talking about that, then how important is early testing, screening, and genetic counseling for families in respect to sickle cell?
Early testing and genetic counseling is very, very important. In fact, is the way forward that is aimed at preventing the increasing incidence and prevalence of the disease. Because if individual is unaware that his hemoglobin combination is AS and he married another individual with AS or one with SS, the chance of having baby with SS, that sickle cell anemia, is very high. Or maybe marry another individual with SC, to have balanced population of babies with carrier state and disease state. The problem with this proportion is you have to give birth to as many as possible babies for you to have that ratio according to the theory of evolution. So for us now, human beings, the number of babies a woman usually delivers is limited. You may be unlucky that all your babies may be sickle cell anemic. Some may be lucky, all the babies may become carrier. But since this thing is based on chance, nobody can be able to know. So it's rather avoided than tried, because chances are that you end up giving birth to a baby that carries the disease, and you cannot afford to see the agonizing chronic pain that this baby will be going through.
So are there treatments? Are there treatments for sickle cell patients, especially in Gombe states? What are the treatments?
Okay, ma'am. So the treatments, well, from the medical point of view, we say management.
Okay.
How do we manage individual patients?
Okay, so you don't actually treat like
we
malaria,
treat.
you manage.
Yes.
Okay.
We treat, but we prefer to use the word management.
Okay.
How we manage the disease. So the disease management is under supportive care, then the preventive care, then the curative care. So when individuals talk about treatment, the normal non-medical belief about treatment is cure. But in the medical setting, when we talk about management, certain diseases you cannot be able to maybe treat completely. Like if you have malaria, you take anti-malaria and that malaria is gone, except if you have another infection. Sickle cell anemia and some other conditions, they are not like that. So how do we manage based on what we have and based on what is available at our disposal? So for the supportive treatment, usually we counsel the patients about the precipitating factors for this vaso-occlusive episode, what we call painful crisis, because they are the common and most agonizing symptoms or signs the patient will come with. So the supportive treatment, that's for the individual that already has the disease, is born with it, you understand, and is already maybe a grown-up adult. We give supportive treatment by way of counseling. We counsel them on liberal oral food intake, because we believe that if they are not dehydrated, the sickle-shaped hemoglobin may not cause blockage of these vessels and result to pains. Then we also encourage them to be regular with their clinic follow-ups. There are certain drugs that we give them that is believed to either prevent them from becoming infected or having issues with their blood system, the blood in the circulatory system. Like commonly, we give them proguanil, folic acid, counsel them on the importance of adhering to the drugs, as well as also other drug treatment that would prevent complications like hydroxyurea, which in some countries that prenatal diagnosis are available, they commence it as early as possible, because some of our patients, even at the presentation, the time they first present to doctors, they already have developed some complications. So this now emphasizes the importance of prevention. So for the prevention, usually prenatal diagnosis is offered, although it's not available here in Gombe as far as I know, but I have heard that it's available somewhere in Jos and in the Sickle Cell Foundation in Lagos. So it's usually prenatal diagnosis is a kind of joint procedure with sampling of the fetal cells while the baby is still in the mother's womb. To sample the fetal cells, what we call chorionic villus sampling. The gynecologists usually do that. Then the cells of the fetus, that's the growing baby, and is analyzed with the help of modern diagnostic technology to know whether they have inherited these forms of hemoglobin. So if the baby is confirmed that have inherited these abnormal hemoglobins, so immediately after the baby is born, baby will be closely followed up from the 8 months before the baby even reaches the 1 year. By 8 months, as I mentioned earlier, we believe that fetal hemoglobin is now being knocked off. So we begin to anticipate baby may be developing symptoms. So usually in advanced countries, they commence this hydroxyurea. It's a drug that has been tested globally to prevent these complications by way of increasing this fetal hemoglobin that we mentioned earlier that confers protection in the baby. So if there is a drug that can increase the production, even though the normal body system is to knock it down to stop production by 6 months of life. So that drug hydroxyurea increases the production of fetal hemoglobin. So if the fetal hemoglobin is increased, and because it has very good oxygen carriage that I mentioned earlier, so it will prevent the initial stages of all these complications, because the complications begin when this sickle shaped cells, when the normal red cells become sickled and begin to cause problem in different body parts. So part of the supportive treatment is the hydroxyurea. Then the preventive aspect is to diagnose early. Where the prenatal diagnosis is available, they are diagnosed early. But for Gombe here, what is available is the early neonatal screening. Usually once the baby is born, the genotype, probably they marry, they don't know their genotype, and fortunately for them, the baby is delivered in the facility. There are available kits that we can use. We have laboratory that can make the diagnosis based on the agents that we have to know if the baby has the sickle cell anemia. So if we cannot do the prenatal before birth, immediately after birth, before the mother is discharged, they are counseled to come and do neonatal screening. So if the baby is screened and found to have inherited these abnormal hemoglobins, the baby will be closely followed up. So by the age of 1 year at most, the baby should be commenced on this supportive care. That's at least with the hydroxyurea. That's what they practice in abroad. But for ours here, it depends on the time the patient presents to us. Usually when they have already developed these signs and symptoms. Then other part of the supportive care is vaccination. So apart from the routine national immunization vaccination schedule, there are special vaccinations against certain organisms that affect this individual more, like the what we call streptococcal pneumoniae. So there's what we call pneumococcal vaccine. Usually these individuals are offered pneumococcal vaccine. Then before the age of 5, usually drugs like penicillin B is also given to like a kind of prophylaxis, like prevention, even before the organism enters their body and begins to cause trouble. They are either have been vaccinated, those that have not been vaccinated will be given the penicillin, and the penicillin will not allow the organism to cause trouble. So all this package of care is categorized under the supportive care. Then the preventive care is the one that ensures that partners are counseled from the beginning. What we call premarital counseling is part of the prevention. So if they are counseled that they should have their hemoglobin electrophoresis or genotype, as a common layman's term is genotype, but although it's phenotype from our own point of view, so they are counseled not to marry to avoid having babies with sickle cell anemia. It's another way to go. Although there are so many debates and arguments against that, why will you stop somebody from marrying the love of his life? Is it really truly justified? You understand? So, but for us in Gombe and Nigeria, we encourage that these individuals that carry the trait and the individuals that carry the disease should not marry, because we consider our level of technology.
Okay, I'll come.
So sorry, we did again regarding the treatment. We talk about the supportive and the preventive. We also have curative. I did not talk about the curative. The forms of treatment. We have what we call the stem cell transplantation. That involves conditioning the bone marrow. The bone marrow is the site in the body, in the adult, that red blood cells are produced. So usually the bone marrow is ablated. All the components that produce this abnormal hemoglobin will be destroyed. Then a normal one will be introduced to the bone marrow, so that it take over the bone marrow and produce all the normal cells. That's what is called stem cell transplantation or bone marrow transplantation. Any individual that successfully undergo this bone marrow transplantation is considered cured. That's for himself. But still is not encouraged to marry an individual that has the trait, because it's only in her own or his own body system that this disease has been cured. Down his DNA, that's the genetic information that carries his information about his normal body function. The gene is still there. So if he marries, he has risk of producing baby that carries the disease.
So the treatment is actually for the individual.
For the individual. Then the next treatment that has been under investigation, under trial, that I think it was last year, somewhere in December, that was approved by both the Medical and Health Regulatory Agency in the UK and Food and Drugs Administration in America, is the gene therapy. So scientists are looking at going down the gene and manipulating the gene with the aim of increasing the production of that fetal hemoglobin, thereby preventing the individual from having the initial cascade of event that leads to crisis. Also, individuals that undergo the gene therapy are also considered cured for their own body system, not for the offspring they are going to produce. Although these treatments are not readily available in Nigeria, for the stem cell transplantation, that's the bone marrow transplant, is available in 2 centers in Nigeria that I know. think in in Benin and in Lagos. Lagos University Teaching Hospital has started stem cell transplantation for sickle cell anemia patients. And it has been ongoing in, I think, private tertiary facility somewhere in Ibadan that was championed by one of our professors. You might have heard of him, Professor Bazwai in Benin. I think he has been doing successful bone marrow transplantation for sickle cell anemia patients. So these are the curative.
Okay.
Why I was avoiding the word treatment. When you say treatment,
Yes.
people begin to think it has gone forever. So we call it curative, that's cure. But other preventive measures, supportive measures are aimed at minimizing the complication that can come or the ones that are already set in.
So we come to our warrior, Aisha. Can you share with us how it has?
Okay. Good day, everyone. Living with sickle cell disease is actually not easy. I was diagnosed at the age of 7 when I was in primary 2. So as a baby growing up, we are all that kind energetic, you do activities, play in the rain and the like. So I wasn't showing any symptoms until that age of 7. I was at school at the playground, and then I started having the back pain, and they took me to the school, they gave me PCM, and later on I went back to class, but the pain came back. So my dad was called, they picked me up, and we came back home. So after a day or two, the pain keeps going and coming back, and then FTH was even under construction. So we went, and they said I was diagnosed with sickle cell anemia. My parents at first didn't believe it because I was very energetic. I was doing gymnastics, playing football and all, like, because I grew up in between two male siblings. So I was always with my brother. Anywhere he's going, I'm clinging to him. So you can understand the kind of rigorous play young boys do. So growing up and learning I was sickle cell patient, I hardly have crisis. It comes maybe once in a year or 1 in 8 months, which makes my parents to doubt if I'm truly a sickle cell patient. A lot of the activities I was doing before the diagnosis, doing it, I was still energetic and everything. But then my life took a turn and changed when I entered university. So that was the first time I even got admitted in a hospital with the name of having sickle cell crisis. So the change in environment and activities, stress, malaria, because I was staying at the hostel when I was in part 1. So all that factors exposed me to, and my immune system kind of changed due to that factor. So I kept having crises on, and I have to go back to the hospital, and then I started attending clinic. So it wasn't easy. You are sick, you are very fine, very okay, and the next minute you're in pain, and people were just saying it like, oh, this has to do with genes, and that is aljanu. So people refer it to aljanu because they see, okay, 1 minute you're okay and the next minute you're sick, so they think it was aljanu. But my parents knew that it wasn't aljanu. So we're going back and forth in the hospital, seeing my doctors, taking my drugs. It helps with the pain and it also helped me with having frequent crises, which it's decreased. So it wasn't easy. I will miss school, I will miss activities, family time and everything, because sometimes even in the middle of the night the pain will just wake you up and you cannot go back to sleep again. You spend days, week on admission, the pain will not go. It's like you are being, cannot be deferred. It's excruciating, and life has to go on. I need to go on and continue doing my activities ranging from school and everything. It hasn't been easy and it came with challenges, but God's so kind. My family were the best. They gave me all the love and care I needed, and they make sure that I follow the do's and don'ts which my doctors gave, and I was taking my drugs, having a nutritious meal, and everything was going smoothly. So one of the things I knew that helped me with sickle cell anemia, it was knowing my body system Along the line, I was growing up as an adult, so I know these and these were my triggers, because most of the triggers of sickle cell anemia is stress, malaria, dehydration, and cold or hot weather. So I knew those were my triggers and started preventing it, because when the pain comes, okay, my family are deeply involved, they will pay for the medical bills, but then the pain I was having, that will not suffice. So I started paying attention to myself and to my health as well. So when I know that, okay, I will do this and I will not push myself, I won't cross the line, because I know if I do that, my body system will not handle. I made sure that I was using mosquito net and also fleeting my room, staying away from mosquitoes, and I was taking a lot water. As you can see, the first thing I did when I came here was to ask for water. So I also avoid cold baths or anything very cold. And if the weather changes maybe to a hot weather, I make sure that I'm wearing a very light cloth, because you'll be sweating, and urinating as well, which can make you dehydrated. So if you're not taking enough fluid at that point, you can easily fall sick. So it comes with some kind of challenges. I can remember during my junior secondary school, there is this teacher. My parents actually, after finding out I'm SS, so they took my medical report to the school and informed them that, okay, this person is a sickle cell patient, and please these are her triggers. So the school knew that, okay, there are some punishments that I was not allowed to do, or school activities that are very rigorous. So they told the school, and my head teacher, class teacher knew that. So on one occasion, I can remember I came late for school. Classes start at about 7:30 also. So this particular teacher was like, okay, you go and do front job from that side to this side. I told her I cannot do it. And one of the teachers, yes, this one is a sickle cell patient. The proprietors even informed us about her. Give her be lenient on her, give her another punishment, but she insisted that I must do it. So immediately I started the frog jump. I almost fainted. I fell and gasping, hyperventilating because of that punishments she gave me. So immediately they picked me up, and the crisis came. So they picked me up to the school clinic, but then the school clinic cannot manage me because I was in crisis already. So I have to be taken to the hospital. So and at the university as well, university is not like secondary school. Even though still my dad submitted a medical report to the university as well, to my HOD. So on days where I missed CA, there are some of the like our departmental courses, they would be lenient to me, because okay, the HOD has already informed them, and anytime I'm sick, I make sure that I'll get a medical report and submit it back to the school that, okay, on so date I was absent and this test was being done, so I want a make-up. So my department, they tried, but borrow elective courses, I missed that one. I missed them as well. And if you go to the lecturer, he say no, he doesn't care. Go, I will see you in class. They won't give you. So this was one of the challenges also. And living with sickle cell, you need a skill. You need a way in which you can grow career-wise and also be able to have some financial at your hand. So during job application, sometimes you are required to submit a medical, and more times in one or two occasions, after you have passed the interview, aced the exams, and during documentation you submitted a medical report that medical certificate of fitness, you are this, you are SS. Next thing is the employer will reject you, saying no, you are a liability, you cannot work under his company, he'll just be paying money and you won't be coming, you're always sick.
But do you think you're actually a liability?
I'm not a liability, but that's how the general public sees it. So a lot of warriors are having this challenge when it comes to job, be it private or public sector. immediately you submit a certificate of fitness, that's the end. But there are some few who, okay, seeing your talent and what you have, to give you the opportunity to work.
So where do you find your strength to keep going?
My strength actually comes from my dad, my late dad, and my family. So my family, I will always appreciate them. There is this my older brother from Abdul Karim Magaji. So he even studied pharmacy for my sake. I was the reason why he chose pharmacy, in the name that he wants to find a cure for sickle cell anemia. And till date, we do all activities together. Whenever I'm sick, he will be the first person I will call before, okay, tell him, oh, I'm sick, I'm dada. So my family were there for me. Everyone, my dad, my mom, they always encourage me. Anything sickle cell activity I'm doing, they will encourage me, my career, my business, and everything. So they going, show me the love. There wasn't a day or time in which they say, oh, we are tired with you, we are tired of spending money, or we are tired of waking up middle of the night and going to the hospital. They have been there for me, and they have also invested their resources in me. And the second one is my friends. Yes, I have this cycle of friends who have never stigmatized me. Anytime maybe we plan for an activity or wedding and I wasn't able to chance, because you can, okay, just get ready now, you want to go out, and next thing you're down with pain. So they understood that things happen in my life, and my health also, it always comes first, so anything can happen. So they understood that, and they were always there to fill in the gap in anything I need. Friendship. And then our doctors, as you can see, I'm here with one of them. So they give us this strength and capability to go on. Anytime you are in need, you are sick, once you step your leg into FTH, even if it is A&E, we have a special sickle cell center at the FTH, and I can say it is one of the best in Nigeria. Our doctors are very friendly. They are always welcoming. You can be sick 3 a.m. You call them that you are in the A&E. Next thing is they will call the doctor on call and tell them, oh, this is our patient, please take care of him before in the morning we'll come and do proper. So they are one of our strengths.
So what do you wish others knew about sickle cell?
I hope and wish that be a warrior or non-warrior, to know that we are warriors, not sicklers. That word sickler, to us, it's a stigmatization. Yes, it is derogatory term. So we prefer to be called warriors, because we are actually fighting a battle, and a lot of people cannot handle this battle. We are actually legends, not just warriors. We have a lot of sickle cell ladies who have given birth to 2, 3, 4, 5 kids. And normally they say that labor pain is the most painful, painful kind of pain people experience. But if you ask sickle cell warriors who are mothers, they will tell you that they prefer to give birth 10 times than to have one single crisis. So you can just imagine the pain, how it is to compare it with labor. So I hope people understand that we are stronger than what they think we are. A lot of sickle cell warriors, most of us, we are very, very intelligent. You will never see a sickle cell patient that is dull. If you give them the opportunity to work or talent, you will see that they are very good people. If not, at the end of the day, okay, they are paying hospital bills day in, day out, almost every time in the hospital, and this person doesn't have a source of income. You're denying him just because of something from his medical challenge. Give that person a chance. Stop looking at us as liability. We are not liabilities. And I also want people to understand that I was married the love of my life. The first thing you should do as a person, when you saw someone and you're interested, the first thing you should ask is, what's your genotype? There is no need for you to go and spend 1 year, 2 years, 3 years, and at the end of the day, when it is time for the wedding, you are presenting certificate, you are AS, and say you cannot, you're going to die if you not marry the person. So the first date question should be, what's your genotype? Yeah. If you see somebody you like him, first time ask the genotype. If it is compatible, you can go. If it is not, from that place, you won't even put your heart and mind and resources in the relationship. So I want people to understand that if we do not eliminate this AS of AG, then sickle cell anemia cannot be eradicated. It will still continue. And it is a very bad thing for you in 2025 to still not know your genotype or be giving birth to sickle cell babies. There are a lot of information out there about genotype and sickle cell. Why should you bring a child into this world with such pain? Love doesn't want it if your child would bear the pain of your selfishness or greatness.
So the treatment, how expensive and what code do you have in respect to treatment of sickle cell patients?
Treatment of sickle cell patients or the cure, it's actually very, very expensive. For even the bone marrow transplants doctor talk about, it's about 50 million naira.
Wow.
99% of sickle cell patients, they are not financially stable. They are having, if you come to our meetings or clinic, from the look, you know that okay, this set of people, they don't have money. So among the warriors, we say 150 are being born yearly in Nigeria. Out of these 150, it might be just people that will be able to afford the bone marrow transplant. Because sometimes even the routine drugs, folic acid, paludrin, our warriors cannot buy it. Someone will be sick in crisis and he doesn't have money to come to the hospital. He'll start calling maybe the doctors or we, the executive of the association, who I'm sick, and will pay from our pockets. Even our doctors, that's what they do. That's why I said the Sickle Cell Center in Gombe is one of the best. They give us access to them and health services. They remove money from their own wallet to pay for drugs, blood donation, or anything related to sickle cell to their patients. So you can see how encouraging they are and how invested they are. And the gene editing that they approved last year, I think about 1 billion naira after I converted the money.
The list.
The treatment.
The list.
Yes,
the
One
list.
campaign.
list. One
Where
campaign.
the services or the treatments are available is $2.2 million US. So when you convert it to Nigerian naira, it's somewhere around 3.2 or 3.5
billion naira. So who can pay
that's going at the rate of 1,600 naira per dollar.
So
$1.
what call do you have to government partners to come to the aid of sickle cell, especially in terms of treatments?
Because as I have always said this, and I will mention, the government are not helping matters, honestly. Sickle cell drug should be at least, in Nigeria we're having the highest burden, but no special discount on sickle cell. If they can be sharing condoms for free, why won't they share sickle cell drugs for free? Folic acid, if they cannot give us freely, then they should subsidize our treatment, our drugs. We should be like giving a free, if we cannot be having a free care or something like that, at least it should be subsidized. But no subsidy, no free services, and people die daily. And we keep giving birth to sickle cell patients. So the burden is just adding up day to day. We keep calling on the government to please come and intervene in this. Because if they do not, and they should make the genotype test compulsory and everybody. You know, some people, okay, they marry in mosque, church, and others at home. Now the religious institute, they also made it compulsory that you must submit a genotype test, be it in church or mosque. But there are still people that they do their wedding just in their family house and all. So genotype test should be made compulsory on everybody. And then they should come in and intervene, provide us with drugs, give us free access to medical services, because we are always developing one complication to another. Any place that blood is as a sickle cell patient, crisis can attack. There are incidents whereby some of our patients have turned blind due to they have lost their vision from crisis.
Doctor, as the world mark Sickle Cell Day,
Yes, ma'am.
what role can communities play in supporting people with sickle cell?
Okay, thank you, ma, for the question. The world has chosen this day think by the United Nations, not to celebrate it per se, but to create awareness about the disease, as well as what an individual and community level the role individual and community level can play in providing support, as well as preventing or decreasing the prevalence of this disease. The community has a very important role, and I think the heads of community development, world development,
WDCs,
the WDCs, well-meaning individuals in the community, philanthropists, journalists, everybody in the community has a role to play. This day is marked for creating awareness and enlightenment. We should continue to inform people about this disease, as well as to encourage them to know. Those that don't know their genotype should screen their babies for commencement of early management of the disease. Also, the community should take it as a responsibility to ensure that no couples will be allowed to get married, whether in the mosque, or in the community, or at the King's Palace, or anywhere, without presenting a valid and reliable result from a laboratory that has the capacity to make diagnosis that they are fit to marry, or they are matched couples. So if the community has taken upon itself to ensure that no couples will get, no partners will get married without ensuring that they know their genotype and they know they are compatible to marry, I think it will go a long way in reducing the number of babies that are born with this condition.
Okay. Aisha, as we wrap up, what's your final message? What's your final word to our viewers?
My final message will always be: know your genotype before saying yes to that your handsome partner. Know your genotype. Sickle cell is very, very expensive. Very expensive, actually. You as the lady, always, this man can go and marry. If you must marry him, just know that this man can marry 3 extra wives and they will give him healthy babies. You with the sickle cell child will always be in the hospital. You will be emotionally drained, financially, psychologically, mentally. You will be out there. Okay, you need to step back. It's not something that you say, okay, I must marry this person. Once this child is sick, whether you like it or not, at the end of the day, it is this particular child that will be making you to fight, you and the guy. And at the end of the day, he might just go and marry someone who is AA, and she can, and your own is finished. So your child doesn't deserve that. He needs to live happily. And to those of us who already have sickle cell patients, we should take care of them. There are instances where family will just get tired and then throw the person out. If you do not love your own blood, who will do that? There is nobody that will do that. So support sickle cell patients. Let's break the sickle cell cycle together, and let's know our genotype. Stop stigmatization and discrimination against sickle cell patients.
Doctor, your final word.
Okay, thank you, Ma. Although certain aspects of what I wanted to talk about as my final message to the community, government and non-governmental organizations, I can understand some of the warriors' statements are full with emotions because of what she has gone through. But I think at the government level, government anything, but it needs to improve on what it's doing. We are in an era of renewed hope. So I believe at the federal government level, the state government, the government can do more to renew the hope of these our sickle cell warriors. Well-meaning international organizations, philanthropists, other people, everyone has a role to play. If you don't have a sickle cell warrior, in your family, probably your neighbor has. So if you can still do well by supporting and helping that sickle cell warrior. There are other aspects that we have not been able to capture, other complications like retinopathy. It can cause blindness, chronic sickling. It can affect the heart and cause sickle cell cardiomyopathy.
Yes.
And you know, once something is wrong with the heart, there's a problem. Mortality is high, chance of dying is high. It can affect the kidneys. Even the normal individual, when they have chronic kidney problem and they are under dialysis, the outcome is very bad. So male patient can be having frequent episodes of priapism, which like the vaso-occlusive crisis is very painful. Some of them that have experienced it wish they were not born because of the kind of agonizing pain they go through.
And from
So
that,
I think
infertility as well.
the issue of infertility. So I think if it is possible at the state and the federal government level, and with the renewed hope administration of increasing the number of vulnerable people under the health coverage, I think this particular group of patients or warriors should be given priority. Wherever they are, once any patient present with sickle cell anemia, if they are under national health insurance coverage, at least a good percentage of the burden, economic burden, will be relieved for the parents. So I think community, government, non-governmental organization, if we can all come together, it's not like we are supporting the spread of the disease, but looking at our socio-cultural background, this is the way to go, because whether we like it or not, they are still citizens of the country.
Yes.
And it's also obligation or responsibility of the government to take care of this group of individuals.
Thank you, Doctor.
Thank you, ma'am.
Thank you. Our time is almost up. Thank you so much. As we have heard, viewers, sickle cell may not leave physical scars, but sometimes it does. Like we heard, it causes even blindness, infertility, and others. It deeply affects childhood to adulthood. And behind every painful episode is a person with dreams, strength, and a story worth telling. Today, we have not just heard about the science, but the heart, the human side of the story from Aisha. On this World Sickle Cell Day, let us play a role. Get informed, get tested, positions, support policies that bring better healthcare and prevention. Because behind every number is a name, a face, just like we have Aisha here. She's a fighter, a warrior. So it's not just about statistics, it's about human beings. Thank you, Doctor, for the insightful contribution to this program.
Thank you, ma'am.
Aisha, it's been nice having you. Thank you for coming. And we hope to see more of you someday.
Inshallah.
Viewers, thank you for joining us today on Health Talk. And we have heard from the warriors. So we see, let's stand and fight this disease that has caused many pains, that have caused many homes, that have broken many homes. Let's continue to support and ensure that treatment is free or minimized or subsidized. And also, as the warrior said, when it comes to marriage, let's know our genotype. Thank you very much for coming. Thank you for coming.
Thank you.
Thank you. We'll see you next time in our program. Stay informed, get tested. Thank you.
Thank you for having us.